have as a next topic on the agenda drugs which prolong QT. And you already heard from few of us how important the topic is. We'll cover it relatively quickly because there is some repetition already. But what I wanted to stress, and you already saw this QT in various forms and shapes and how to measure it between beginning of QRS and end of T wave. And what's really driving, as you heard a moment ago from Dr. Rosero, you are speaking about these channels again. I'm repeating certain messages which you already heard. You have these sodium currents which go into your heart, into your cells to really make the heart pumping out. And there is also some influx of calcium ions. But these extra ions, which are positive in charge, create kind of overcharged cell, electrically overcharged. And thereafter, during this so-called repolarization phase, these two currents, one is potassium and another potassium, they are rapid and slow, these why it's R and S, they operate here and they get rid of these extra positive charges from this cell. Okay, it's almost like electrical battery you use for every toy or every appliance. This is pretty much the same concept of flowing energy over here. Why I'm showing it? Because in fact, when you move to long QT, this is exactly more complicated slide. Forget about left part, but if you look over here, you see those channels. There are a few more which we will skip, but they are really behind those LQT2, LQT1, and LQT3. So those are channels which are affecting. And there are QT prolongation, which you see here schematically, is really something which creates condition for arrhythmia to occur. And this QT prolongation, we spoke about it today all day, that could be congenital, which is long QT we discussed, but could be acquired. What does it mean? That certain conditions, especially drugs, which is the main topic here, could prolong QT, not only the genetic alteration, but those channels, those currents which I showed you, whether it's potassium, calcium, or sodium, could be affected by various drugs. Also, additional situation like slow heart rate, which is called bradycardia, may prolong QT, lower potassium level, which is called hypokalemia, and these are abbreviation for heart failure, left ventricular hypertrophy, those conditions which, as you heard, are more along the line of aging. So there are a number of drugs which eventually may affect ion channels I just mentioned. And you speak here about clarithromycin and erythromycin, which are common antibiotics used for really various infections. You have antiarrhythmic medication, which obviously is used for heart conditions. There are some drugs like tamoxifen in cancer. There are some diuretics, some so-called calcium channel blockers. There are some antidepressants. We spoke earlier about it. So there is a number of drugs which affect those ion currents. And in fact, over years, there were some drugs which were removed from the market. This date of withdrawal, which were years ago, and there were drugs which are popular drug terfenadine, which was antihistamine over the counter. After searching the data, we learned that these drugs, in combination with other drugs, may eventually cause this prolongation of QT and torsade de pointes. And few other drugs which you have here were removed from the market because they were really causing arrhythmia, and they are almost all no longer used, apart from maybe from one for some very rare indication. When you speak about experience, there was a paper which was published just like months ago, which looked at Denmark, and they look in Denmark and some population long QT patients. So as you may know, Denmark and Sweden, they have national health care system, and they have national records, meaning that they have everything at their hand. So we are very much benefiting over the last 5-10 years from very elegant studies done in Scandinavia, because they have access to all the data from all the patients. There is no issue with insurance, everything is covered, everybody is happy. As you know, Denmark is the happiest country in the world. And they have really good healthcare system. What they did, they searched the database, and they found in the database 279 patients with long QT syndrome, and they look at their pattern of taking medications. And all of a sudden, they learned that 60% of these patients were treated with drugs which prolong QT after they were diagnosed with long QT. Okay? So this is a problem which is not only a problem for patients who should be aware, but also for physicians who prescribe these drugs. Okay? So the most common prescription using 167 out of those 200-something patients were still antibiotics, 1/3 of them, as you see, 34%. So the antibiotics, there is a number of them which block this potassium current, so-called IKR, and they should be avoided if possible. Of course, there are life-threatening situations, life-threatening infections, where you have to take this risk. But most of the time, you can eventually select another antibiotic. We heard already about antidepressants today. Yes, there is wide spectrum of antidepressants. Some of them are less, some of them are more potentially harmful. The antifungals and proton pump inhibitors, which are of lesser risk anyhow, and as I mentioned, they found 60%. So we need to keep this in mind. And this was kind of like editorial to this paper written by Dr. Peter Schwartz, about whom we spoke about. And he speaks about exactly IKR blockers, that this is kind of like ticking bomb if you give somebody with long QT this kind of drug which blocks this current called IKR. So we should all be aware of it. And you heard a couple of times about this credible med. This is Arizona, University of Arizona initiative, which is really appreciated all over the world. The group of experts under leadership of Dr. Woosley, whom we know well, he is very big expert in drug-induced QT prolongation. He established this kind of special engine which informs physicians and patients which drugs, based on the most current knowledge, most recent data, could prolong QT, and which should be potentially avoided, which could be eventually avoided. And as you open this website, which is open to everybody, you have drugs which are called known risk drugs, and this is stop sign here, as you see. There is possible risk. So there are some data, although maybe not fully convincing. Conditional risk, which is more theoretical based on action of the drug. And special risk is really for very arrhythmic patients, so we can skip for a moment that one. And this is the same pretty much summary which I showed you summarized. This is more detailed, a list of drugs which were used in this Danish study, various antibiotics, various other drugs which are eventually harmful, but it's written here, some of them are known risks, some conditional, and some of them should be really avoided. So we need you to be really aware of it. And this is the app about which you heard about from few of us. You can download this app, Credit Meds Mobile, and when you go to physician, when you have cough or you have some infection, cold, and all of a sudden they want you to give some medication, as you heard, you can do 10 seconds, you can keep on the medication name and check, is this suspected drug or not? And there are over 200 drugs on this list. So obviously not everybody will remember all them by heart. So thanks God we have internet, and it works so quickly now these days. So that just to give you an idea how well things are going, that September 15, this is what I got by email a few days ago, update what new drugs were listed. And they are updated constantly. And so if you get this app will be automatically updated. And these are, again, based on literature data about cases of drug with torsade, or data from animal studies or other preclinical studies which show that something is not right. It's constantly updated, and we wanted to make sure that you all are aware of it, and you make aware of your physicians who may not all be that, let's say, sensitive to, let's say, this list all of a sudden appearing, which we may not know that these new drugs were just assigned certain category of risk. Last, my slide speaks about another study which just appeared. We knew about it, that it's brewing, but we didn't have really good hard data. And just recently, a few months ago, this paper came up. We knew that grapefruit juice is not good for us, okay, from the standpoint of QT prolongation, or at least combination with other drugs prolonging QT. But there was never a study done in long QT patients, and colleagues from Israel, they just published this paper when they consider grape juice like a medication. They conducted exactly what we're supposed to do with any new drug. So let's say company A is releasing new medication, they test this medication in a very specific way. How they do it, they take medication, let's say antipsychotic or new antibiotic. They are obliged by FDA and by European community to test this drug in certain conditions and compare how this drug is prolonging QT in comparison to some standard we know. And what is the standard? There is an antibiotic called moxifloxacin, which we know that prolongs QT on average by 12, 14 milliseconds. So this is so-called positive control used in all these studies. So the company A, whether it's Novartis, whether it will be this or the other Merck, or you name it, pharmaceutical company, they take this antibiotic, they give to healthy subjects usually, and they give new drugs they are developing. And they compare how much QT was changed in the same patient, in the same healthy subject, after this antibiotic, which we know the response, and now next new drug. So they did exactly the same, but this time not with drug, with just grapefruit juice. And it happened that this grapefruit juice caused very much similar QT prolongation in healthy subject as it did moxifloxacin antibiotic, which is kind of standard case of QT prolongation after drug. What they did next, they gave 1 liter, because it was important to know, of grapefruit juice to those healthy subjects, but they also gave to group of long QT patients. And they found that they have like not 14 or 12, but 24, 26 millisecond prolongation, even bigger. So bottom line is that apart from medication, we need to be aware that some food, in this case orange juice, could eventually be something which you should avoid. And based on this publication, as we discussed this at one of the meetings 2 or 3 months ago, there will be probably recommendations that long QT patients should really not overdose at least grapefruit juice. I don't think that half a glass will harm somebody, but you need to be aware of it. My daughter, when she was young, she drank a lot of grapefruit juice. She had some period where I don't know why she liked it so much, but that's okay. And she stopped drinking. She doesn't have long QT, but bottom line is this was part of her story. And I understand that this could happen, that people may like grapefruit juice, and therefore they should be aware. If you ask me what about other food or medication, there are much lower levels of the same compounds that are in grapefruit juice in orange juice, in lemons and few other citrus fruits, but much lower, so one would need to overdose tremendously. And the other drink, which probably should be avoided in excess, is tonic, because quinine, which is in tonic, if excessive, may also block the same currents. So this is something which one should avoid. If somebody likes tonic or gin and tonic, this would be probably wise avoiding. I'm just done. Happy to answer questions.
Sparkling soda, sparkling water, with the flavored lime and...
No effect to our knowledge. Yeah. Any question? Yes, please.
How about the benefits of bananas?
Yes, that's a good point. Bananas are very rich in potassium. So as you heard, two most common forms of long QT syndrome are caused by abnormal potassium channel function. And we believe that having banana, meaning increasing your potassium levels, may help. We even conducted a study where we used a drug called spironolactone, which is diuretic, which could eventually increase potassium levels. And we showed quite good shortening of QT with this drug. The problem is that the drug has number of side effects, and it's not really drug to be used in young people in general. However, it's drug which is used in heart failure patients quite frequently with good effects. So yes, there is, I would say, general feeling that bananas in long QT patients should be good for you. There is no hard study, no evidence class one.
But you say that you can't have the medicine. The medicine, keeping on the medicine is no good.
I mean in shortened QT, we had this study. The problem is that there are a number of side effects apart from diuresis, which people had, and they didn't want to take it for a long time. Yes. Any other questions about drugs? So keep in mind this credible math, and this is probably what you need to remember for this meeting, to spread out this information that this app is there and could be enjoyed. Okay? I think I will invite at this moment Dr. Goldenberg to say a few words about pregnancy, because it is another very frequent question we are getting from our long QT patients, especially women.